Hello, we are the Knowles Insurance Agency, Richard and Samantha Knowles, husband and wife team. We've had the great privilege of serving Medicare beneficiaries for over 16 years. Today I want to talk about a couple of things, stuff that's not covered by Original Medicare. Original Medicare is parts A and B. A is the hospitalization, B is the doctor services. So there are clearly some things that are still going to be out of your pocket. For example, Medicare A and B does not cover long-term care. It's also called custodial care. Most dental care is not covered with Original Medicare. Eye exams that relate to prescribing glasses, dentures, cosmetic surgeries, acupuncture, hearing aids, exams, and routine foot care. So what are the limits on Medicare A and B? Those are things that it does not cover, but let's talk in addition to that, are there limits on what Medicare A and B will cover? So in general, there is no upper dollar limit, no maximum on your Medicare benefits. As long as you're using medical services that Medicare covers and the services are deemed medically necessary, you can continue to use as many services as you need, regardless of how much they cost in any given year or over the rest of your lifetime. However, some individual Medicare benefits do have limits. So, for example, there's hospital lifetime reserve days. Let's talk about that for a second. Medicare Part A covers a stay in the hospital for any single spell of illness or injury for up to 90 days. This is what's known as a benefit period, and there's no limit to the number of benefit periods that you can have. So if you stay in the hospital for more than 90 days with the same injury or illness, you'll have the option to use some of your 60 lifetime reserve days. This additional benefit with Medicare allows you to extend your hospital stay for a higher copayment. And obviously you can use the days however you want. You can use them all or you can use them one at a time. But once you've exhausted your 60 reserve days, you're going to pay the full cost for your hospitalization. Now, there's an exception. Your Part B doctor services are still covered for your physicians, anything under Part B, but the hospitalization would be out of your pocket 100%. There is an exception. If you have a standardized Medicare supplement, it's also called the Medigap, they'll cover an additional 365 lifetime reserve days. Remember, that's after you use your Medicare 60 reserve days. So you have 60 reserve days for Medicare, plus if you have a Medigap, you have an additional 365 days, and your Medigap will also pay the co-payments during that period. Psychiatric hospital stays. Medicare covers only up to 190 days. You cannot use your Medicare 60-day lifetime reserve days for a psychiatric hospital, only a regular hospital. So anything after 190 days would be out of your pocket. Skilled nursing. This benefit is available if you need skilled nursing after you've been in the hospital, and Medicare pays the full cost up to 20 days. Then from days 21 through 100, you have copays. That is, unless you have a Medigap plan, the Medigap will pay the copays through 100 days. So from days 21 through 100, if you have a Medigap, it will pay for the copays, but after 100 days, you pay the full cost. There's also a limit on any therapy services. I always tell people, give Medicare a call to get the specifics, but occupational therapy, speech therapy, or physical therapy, like after you had a surgery, there would be limits on that as well with your Medicare A and B.